Good morning, Mr. Ahern. My name is Sheila Hardesty, and I am Dr. Miller's clinical nurse today. We're going to do assessment of your respiratory system. And I'll report my findings to him before he comes in to examine you. First, I want to ask you a little bit of history. What is your occupation?
Coal miner.
Okay. So you do have a risk for black lung. You're aware of that?
Yes.
And does your company do any preventative measures?
Yes. You take chest rate, X-ray
Every 5 years? Okay. And you've had no abnormal reportings back from those?
No.
Okay. Do you smoke?
No.
That's good. That lowers your risk of having lung diseases. Let's see. Your skin is nice and pink. I don't see any cyanosis or pallor. Take a look at your fingernail. That's here. They look good. Capillary refill is less than 2 seconds, and there's no clubbing of your fingernails, which would suggest pulmonary or cardio disease. Okay, if you hold your head up there, your trachea is midline, and this is your suprasternal notch, which is right above the second rib, which is called the angle of Lewis. You have no superficial venous patterns. That's good. Okay, I'm just going to watch your breathing for a minute if you'll just breathe normally. Okay, you're breathing about 18 breaths a minute, which is normal. 12 to 20 is considered normal, and you're right in the middle of that. If you were breathing less than 12, it would be called bradypnea, which would be abnormal. Greater than 20 breaths per minute would be called tachypnea. Deep rapid breathing is called Kussmaul's breathing or respirations, and that is associated with metabolic acidosis, which is when your electrolytes and kidney function are out of order. Let's see, your respirations are even, symmetrical. You're not using any accessory muscles. You have no pursed lips or nasal flaring, which would be associated with respiratory disorders or respiratory distress. Okay, I'm going to palpate your chest. What I mean by that is feel your chest. You have any tender areas?
No.
Okay, I feel no bulges, masses, pulsations, or nodules. There is no crepitus or friction rubs. What I mean by that, crepitus is a crackling feeling, or you might hear a popping if you were listening with a stethoscope. You would find this when there's air or fluid under the subcutaneous tissue, such as if you were a patient that had a chest tube. Next, I would like to check thoracic expansion, and I will need you to sit up for this exam. All right, I'm going to need you to breathe deep and out. Again. Pull my thumbs down a little bit more for the xiphoid process and out. One more time. And out. Okay, my thumbs move in and out symmetrically. I also would like to check this on your back. And I need to be at the level of the 10th rib or around the 10th vertebrae. All right, take a deep breath. In and out. In and out. One more time. Now, very good. Everything's symmetrical there. Now I'm going to check for tactile fremitus. I'm going to ask you to repeat 99 as I palpate the back.
99, 99, 99, 99, 99, 99, 99.
Okay. Now I'm going to listen as I percuss your back in between your rib spaces, which is called your intercostal spaces, and I should hear equal resonance sound over all areas. Very good. Now we'll do the same thing in the front. Let's see. 99,
99, 99, 99, 99, 99, 99, 99, 99.
very good. I'm percussing just as I did on the back. Very good. Now what we're going to do is measure diaphragmatic excursion. And I'm going to have to sit behind you again for this. I'm going to ask you to take a deep breath and hold it, and then I'm going to percuss down your back, and I'm going to mark the area where the sound changes from resonance to dullness. Okay. Take a deep breath. Okay. All right, now I'm going to ask you to take a deep breath and hold it once again. Okay. Not taking too many breaths, you feel okay?
Yeah.
All right, we'll do the other side then. Take a deep breath. Okay, exhale. And when you're ready, I'll percuss up one more time. There we go. Work both of those. Okay. Now, normal diaphragmatic excursion is 3 to 6 centimeters. We measure, and you're at 4. The right is a little higher than the left side, which is normal because the diaphragm sits on top of the right lobe of the liver. Okay, next we're going to check what we call vocal resonance, which is normally if I listen to you while you're talking or whispering, the sound should be muffled or indistinct. And if there is an altered resonance, you would have clearer or louder sounds when I listen. That would be a sign of consolidation in the lung or bronchioles. I want you to say 77.
77. 77.
Okay. And next, I'm going to check bronchophony, and I want you to say the words 99.
99. 99. 99. 99.
Good. Next, I'm going to ask you to whisper 1, 2, 3, whisper it. Whisper. Okay, I can't hear it, and that is good. If I could hear it, that would be a sign of consolidation. One more test. I want you to say the letter E. Now, if the sound turns to where it sounds like an A to me, or with a nasal quality, that's a sign of consolidation, and you would need an X-ray for further evaluation. So say E.
E. E. E.
Very good. We're almost finished with the lungs. Okay, now I'm going to listen to your lung fields, and I just want you to breathe in and out normally, but a little deeper than usual as I listen. And could you lift your arms? Both of them. Take a deeper breath. And now I'm going to listen to your back in the same manner. Take a breath. Very good. Normal breath sounds, there's 3 types. Vesicular sounds, which are low-pitched and heard with air exchange over healthy lung tissue. Bronchovesicular sounds, which are moderate in pitch and heard over the bronchi. Bronchial sounds, which are high in pitch and heard over the trachea. Abnormal breath sounds, or adventurous sounds that you would often hear with pneumonia, bronchitis, different respiratory disorders or infections. Crackles, which are often heard with congestive heart failure when there's fluid in the lungs or pushing up on the lungs. And they kind of sound like hair crackling between your fingers. Rhonchi, which are deeper crackles with more of a rumbling or coarseness to the sound. Wheezes, they're like a high-pitched musical sound. Sometimes they sound like a whistle. Have you had any cough recently?
Yes.
And are you coughing anything up?
No.
No, just an occasional dry cough. Okay, that's good. When a patient is coughing up sputum, when it is yellow, green, or rust-colored with streaks of blood, it's often a sign of a bacterial infection. Sputum that is just streaked with blood is a symptom of a viral infection, which is less common. A cancer patient may have a slight persistent cough with blood-streaked sputum. Sputum with blood clots in it is a sign of infarction, and sputum with large amounts of blood is often associated with TB. Okay, Mr. Ahern has just went to the bathroom and emptied his bladder for the abdominal assessment, and I've washed my hands, so we can start a new assessment. And Mr. Ahern, if you will lie flat on the couch. We're going to take a little bit of history first. Are you having any problems with your stomach or your bowels or
No.
any pain? No. Do you use laxatives?
No.
You have a normal bowel pattern, you go every 1 to 2 days?
Yes.
Okay. Have you ever had any surgeries on your stomach or bowels? No. Good. Let's see, your skin is nice and pink. There's no jaundice, no redness, no bruising. I do see a scar, but it's more up on the chest.
I have nodule.
A nodule removed. Any involvement with cancer?
No.
No, that's good. Okay. Okay, I'm going to ask you to raise your head, and I'm going to be looking at your abdomen, and then I'll let you relax it in just a second or two. Okay, go ahead and relax. I see no masses, bulges, there was no hernias or any sign of separation, and no pulsations. Next, I'm going to take a listen to your abdomen before I start touching it and poking on it. I should hear what we call bowel sounds in 4 different quadrants, and they are like clicks and gurgles, and you should hear 5 to 35 per minute, and this signals that normal peristalsis is going on, which is the movement of food through the stomach and the bowels. Okay. I hear no friction rubs. I hear no high-pitched sounds over the spleen or the liver. That's good. What I'm going to do, I'm going to listen with the other side of my stethoscope or the bell, just in the top of your stomach there, and then listen to your abdominal aorta. I hear no venous hums and no breweries. Very good. During a thorough exam, the practitioner would also listen to your iliac arteries, your renal arteries, and your femoral arteries that are located down here at the groin. And that would be also to rule out breweries. Okay, I'm going to percuss or tap over the quadrants of your abdomen. Okay, all the sounds seem to be tympani over the stomach and the abdomen and intestines there. Dullness will be heard over organs, more off to the sides, or over masses, or if we were up near the bones. Okay, next we need to check your liver span. And how we do that is we're going to percuss upward, and when our tympani sound turn to dullness, we're going to mark that area. Now we're going to percuss down your mid-clavicular line until the sound changes to dullness. We're going to mark this area. What we're doing is marking the borders of the liver. Okay, we're going to measure that. A normal liver span is 6 to 12 centimeters, and you are at 8. Okay, next I'm going to feel the stomach or lightly palpate. Does that cause any tenderness?
No.
Now I'm going to palpate a little deeper. Okay, I feel no masses or pulsations. I'm going to feel around your umbilicus here. There's no nodules or bulges or granulation. Very good. One thing left. We're going to percuss over top of the kidneys here. And this should not cause any pain or tenderness. Does that cause any tenderness?
No.
Okay, what I'm going to have you do, I'm going to try to palpate the kidneys. Usually they're not palpable. When they are, it's more common for the right kidney to be palpable. So that's what we're going to try to do. And I'm going to have you take a deep breath and hold it. And I'm going to press tighter together on my hands and let you exhale. And if the kidney's palpable, I should feel it slide between my fingers. Deep breath. Exhale. I did not palpate it. Okay, Mr. Ahern, that concludes my assessment. I'm going to let Dr. Miller know my findings, and he will be right in.
Thank you.
Have a great day. Thank you.